So my name is Stuart Lee, and my role formally here is as mental health services researcher, and I lead a team of researchers focusing on exploring the mental health aspects of care for people with a primary medical illness, so for instance a burn or cancer. And the second thing I do is focus on research that's looking at improving the way that mental health services provide care to people with a primary mental illness, so people with schizophrenia or bipolar disorder or major depression as an example. So examples of projects might be understanding the level of psychological distress in people who are treated for cancer, and what factors might help us and help clinicians predict who is likely to have a psychiatric illness or a depression, either as a consequence or as a precursor to some sort of a cancer diagnosis or significant cancer treatment. It's fantastic to be able to do some research that's not just kept in a book, but actually has some way of changing the way that either people provide care or patients receive care. Is very satisfying. So there are many opportunities for honours and PhD students, and in particular working with me, to look at and explore the change of a time in distress for people either experiencing an acute medical illness like a burn, where one example is where we're following for a 12-month a cohort of patients who experience different levels of burn, and we're trying to look at what's the change over time in terms of the recovery in psychological distress, as well as other health and mental health status indicators. Other examples where we're looking at exploring the change in distress for people prior to and following treatment for stem cell treatment for cancer, to see what is the level of distress and what other factors might predict those people who are going to do better than others in terms of the level of distress. The major reason why MAPrc is a great place to do research is that it is clinical. We have strong links with clinicians both in the hospital in terms of the burns and cancer services. We have strong links with the psychiatry service. The research that we do has practical implications, and we have a very short time frame in terms of when we do research and when we have an impact, both in terms of the clinical experience for patients and the outcomes that they experience, as well as the way that the staff provide care. So it's very applied, very translatable.